Safe Patient Project, and we've asked her to lead off today's conference to give us a perspective on this problem that we are all working to combat. So, Mary, can you tell us the story?
Thank you, Dr. Wright. Good morning. It is a remarkable honor to be with you today to participate in the 2012 HAI Data Summit. As my fellow patient advocates from the Consumer Union Safe Patient Project can attest, losing a family member to preventable healthcare-acquired infections is just about the most devastating pain the human heart can bear. I would like to thank Dr. Don Wright and the summit organizers for allowing me this opportunity to speak for those whose voices have been silenced, my mother, Alice Brennan's included. It has been 1,005 days today since my mother's agonizing death from multiple HAIs, including MRSA, C. difficile, and VRE. And not one day has gone by that I have not grieved for her and thought, what could have been done to prevent her suffering and her death? It is my great hope that this conference will indeed help us to move closer to achieving the goal of the National Action Plan or Roadmap to eliminate HAIs. While we will focus over the next 2 days on such critical topics as electronic health record systems, public reporting of HAIs, and the national and state level validation efforts, I implore everyone in this room, please, to remember that HAI has a human face, a face ravaged by this relentless, ruthless, and above all, preventable condition. Like every person whose life has been cut short by an HAI, my mother was a unique individual who was cherished by her family. In Mom's case, she lived life to the absolute fullest. She lived independently, drove her own vehicle, and had a social schedule that would exhaust most 20-year-olds. She was healthy, spontaneous, and like many seniors, suffered from occasional bouts of arthritis. Little did any of us know that when she was admitted to a local community hospital for suspected gout and discharged to a rehab facility for physical therapy, that her days were numbered. We all expected that she would return home from her non-invasive treatments stronger and able to dance at her high school reunion that she had been planning for many months. Instead, she contracted not one, not two, but 3 HAIs. And like many patients of her generation, indeed, even younger patients, my mother would never ask her healthcare provider why certain medications were prescribed, why certain tests were ordered, and she certainly would not have asked her doctor or her nurse if they had washed their hands. And this passive manner cost her her life. As you can see from this chart, the inspiration for which was borrowed from my colleague, Helen Haskell, who designed it to explain visually the errors that led to her son Louis Blackman's death. My mother perished 48 days after her initial hospitalization. She went from driving her own vehicle and living in her own home to dying under hospice care. This, ladies and gentlemen, is the face of hospital-acquired infections. In between July 12th and August 29th, my mother suffered falls, dehydration, UTIs, and medication error, but the leading cause of death, according to her death certificate, was sepsis. And it was this document that propelled me into the patient safety movement. One should not die 48 days after going into a hospital for non-invasive treatment. You should not die of sepsis. When the New York State Department of Health investigated her case, the investigation clearly found problems with her care, including no attempt to follow isolation protocol. When reflecting upon her death, it occurred to me that three of the greatest elements lacking in my mother's care, and most likely lacking in the care of most HAI victims, were communication, transparency, and education. There was an utter lack of communication between my mother's healthcare providers and my mother's family, as well as between the hospital and the rehab facility regarding her HAIs. There was also a breathtaking lack of transparency. Had I known that there were outbreaks of MRSA and C. difficile in the hospital where she was admitted, I would have selected a different hospital, obviously. And finally, when my mother was diagnosed with C. difficile, there was no really any change in plan of action. There was no effort to maintain her bathroom or her room any differently. There was no effort to educate myself, her friends, and our family about how to keep ourselves safe. As a matter of fact, the only advice I received was to use hand gel. And as we know, using hand gel with C. difficile is useless. After her death, I reached out to Lisa McGiffert and the Consumer Union Safe Patient Project and the University at Buffalo Department of Family Medicine and Patient Safety Research Center. I'm convinced that interdisciplinary collaboration between patients, family members, doctors, nurses, and hospitals is critical to enact the necessary culture change that makes patient safety a priority. As a result, I have been a volunteer lecturer on patient safety monthly at the University of Buffalo Medical School and Nursing School, the NYU University Nursing School, and I also participate in grand rounds in area hospitals. I look forward to the challenging sessions ahead of us over the next 2 days, and I would encourage you to ask yourself, as I ask myself periodically, as we look at the recommendations that will come forward, would these recommendations have saved Alice Brennan and the 100,000 patients who are likely to die this year from HAIs? And I would also encourage you to take the time to speak to my Consumer Union Safe Patient Project colleagues. And if they could please stand. Kathy Day, Susan Manganello, Helen Haskell, Alicia Cole, Kevin Kavanaugh, Lisa McGiffert, who have their own painful stories and unique perspective that can only come from those who experience firsthand the devastation of HAIs. Thank you for the work that you are all doing and will continue to do, and I believe that this is true healthcare reform. Thank you.
Thank you, Mary, for putting a very human face on the important work that we do around reduction